Good evening and welcome. I am Jean Johnson, one of the librarians at Stanford Health Library. Thank you for joining us at tonight's talk, Living Well, 7 Strategies Every Woman Needs to Know. It is my pleasure to introduce our speaker tonight, Dr. Karen Adams. Stanford Medicine recruited Dr. Adams out of retirement in July 2023 to create and lead a new program in menopause and healthy aging. She is board certified in both obstetrics gynecology and lifestyle medicine, a field that focuses on the power of lifestyle choices to prevent and treat chronic conditions. She is also a menopause practitioner certified by the Menopause Society and a fellow of the International Society for the Study of Women's Sexual Health. All right, doctor, I turn it over to you.
I'm just very happy to be here to share what I think is accessible information for women to improve the quality of their lives. So I am going to share my screen. I put this talk together because there are things that science tells us really improve our quality of life. And they're not that difficult to do. And so it's something that I just really enjoy talking with my patients about and teaching about because it's so accessible. They're accessible for everyone. So I did, as Jean described, I did come out of retirement to create and lead this Stanford new program in menopause and healthy aging. This is the landing page of our website. And you can see here that our mission statement is here, that our work is motivated by our conviction that the second half of a woman's life can and should be her best years. And the goal is to give each woman the science-backed resources and information she needs to live a life filled with strength, health, and vitality as she ages. So it's a big mission statement, but we are working on it, and we're already making great strides. If anyone wants to hear more about the program or is interested in partnering with us, we're super excited to work with our community colleagues. And I have our program email address on the last slide, so you can reach out to us if you're interested in knowing more. As I begin, I want to just say I have no financial conflicts. Nobody's paying me to talk about any products or anything. And then the other thing I want to just acknowledge is, although I'm going to be using the terms woman and female in this talk, I recognize that not everyone who has ovaries identifies with those terms, and they don't all call themselves a woman or a female. And I use those terms simply because that is how the research defined the subjects and the terminology that's used in the science. And I always want to come back to, what does science tell us about the science of longevity and living a quality life? So when I say woman or female, please know that I recognize the limitations of that term. And I'm actually just talking about people who have ovaries. So as we begin this talk, let's just everyone take a moment and think to yourself about one thing that you are currently doing to support your own health. We so often take care of other people and put ourselves last, but everyone's doing something. So think about one thing that you're currently doing to support your own health. And that might be physical. It might be something that's more related to your mental health. It might be something that's related more to your emotional or your spiritual health. But just think about something you're already doing. You may not be doing it every day, and you may not be doing it perfectly, but you're doing it. And that's, I think, an important acknowledgement of your own self-care. And as I talk about these different techniques to improve the quality of your life, I'm going to come back to 2 themes multiple times, and you'll see I'm going to be weaving them in through this talk. The first one is set up your environment so it's easier for you to make the kind of choices that you want to make. And we'll come back to that multiple times. The second theme is the idea of good enough. good enough, because we are so often so hard on ourselves when we don't achieve or accomplish everything that we set out to achieve or accomplish. And it's really hard. Every day we get up and we do our best, and some days we get close to the target, and some days we don't. But it's a journey, right? And it's always important, I think, to recognize that sometimes just a little bit is all you can do, and that's good enough. So I'm going to kind of circle back to those themes as we go. Okay, so you thought about something that you're doing to promote your own health. So let's go through and see if your thing, as I talk about these 7 strategies, see if it hits on any of the topics. So let's see. Was your thing about good sleep? A lot of people, when they think about something they're doing to support their own health, really they go to diet or exercise. That seems to be the thing that people always default to. But I wanted to start this talk with sleep because it is so, so, so important to our quality of life. And people really struggle with it. And it's very important to really prioritize and work on to try to improve your sleep. There is a big survey that comes out every year, and they survey adults 18 to 80 across the whole gender spectrum, everyone, and they always look at factors that correlate with a high quality of life or happiness. And time after time, the same 2 things keep coming up: good sleep and good sex. And those 2 things, more than anything, across all ages and the whole gender spectrum, predict a high quality of life. So it is important to prioritize those things. So we want to think about how we can make good things happen in the bedroom. Now, I want to acknowledge here up front that many people, many women have experienced sexual trauma, and that the bedroom is not always a safe place for everyone. And that is just an absolute tragedy of our time. And I just want to acknowledge that. But I also want to say that this is a time when you want to set up your environment for success so that your bedroom is a place that you want to go to. So what sorts of things can we do to set up our environment for good sleep and for success in that realm? Well, certainly, you want to invest in comfort. You want to invest in a beautiful, safe, cozy, cool space to go to when it's time to go to bed. So get your fluffy pillows and your fluffy blankets, get all the screens out of the bedrooms. You don't want any TVs or iPads or computers or anything like that, because that light hits your brain and it tells your brain it's time to wake up. So you don't want any screens there. You want blackout curtains. You want a very dark environment, iPads, eye shades, if you can sleep with those. So, and then keeping the thermostat way down or having a cooling blanket, something like that. All those things you can just do ahead of time to promote good sleep. I spoke at a meeting about a year or so ago on menopause, and one of my co-presenters was a woman who was a sleep neurobiologist. And I just learned a ton from her. And one of the things I learned is that melatonin actually really works, but most people take too much of it. And, different stores sell big jugs of 5 milligram or 10 milligram. And what she said is that all you need is 1/2 to 1 milligram. But most people take too much, and they take it at the wrong time. The other thing is you don't want to take it right when you go to bed. You want to take it 3 to 5 hours before you go to bed. So like at dinner time. So 1/2 to 1 milligram about at dinner time, and then bright light first thing in the morning. And she said, and I don't care if you live in Arizona, I don't care if it's August, everybody needs a bright light, like a therapy light, like 10,000 lumens. Turn it on for 15 minutes while you're getting ready in the morning. And the combination of those 2 things really help to set your circadian rhythms, and they impact your pineal gland. So that's something simple you can do. If you struggle with sleep, it's important not to nap because that just messes up your body clock. And it's also important to get up and to go to bed at consistent times, whether it's a holiday or a weekend or whatever. Now, if you sleep great and you don't struggle with sleep, sleep in on the weekend. That's totally fine. But if you're struggling with sleep, try to be consistent with your getting up and going to bed times. And then the single most effective treatment for sleep disturbance, particularly if you wake up at night and then you can't go back to sleep, is a thing called cognitive behavior therapy. And in particular for insomnia, it's very effective because it teaches you to pay attention to what's going on in your brain, because what usually is keeping us awake at night is not a headache or back pain or something like that. And we think it's normal to wake up twice a night to pee if you're 40 or so or older. But the question is, you get up to pee, can you get back in bed and go back to sleep? And for most people, when they can't, it's not something physical, it's their brain. And their brain's running over here and running over there, and you're thinking of all kinds of things. So cognitive behavior therapy, especially if it's combined with mindfulness, kind of breathing practices, can be very, very helpful. And there are books that you can, and there are apps that can help with that. The other thing that really predicts a high quality of life is good sex. So what do we know about that? Here are some books that I recommend to my patients. None of these authors are paying me to talk about their books, but these are helpful. One thing I want to give you as a very important message is it is not normal for penetration of the vagina to be painful. And so some women have pain with PIV, what we call penis in vagina, or anything going into the vagina. Some people have that from the very beginning. Other people develop it as they go through menopause. About 50% of women, when they go through menopause, will start to experience pain with penetration. Now, about 50% do not. And it's not a given that you will have pain with vaginal penetration. I have a patient who is 80 years old and she's having sex with 2 different men and she's not having pain at all. But if you do have pain, it is 100% treatable. It is not normal, and you should seek out someone who can help you sort that out. In the absence of pain, if you're not having pain, the most common concern about their sex lives that women have is low libido. And they just say, you know, I don't want it, but I wish I wanted it. And they feel really sad about that. So there are some models of human sexual behavior that can help us understand what might be going on there. This is the classic sort of Masters and Johnson linear model of human sexual behavior. This is the model I was taught in medical school back in the mid 80s. And it's very linear, and you can see that it starts with desire. So desire is the starting point. You move through arousal, then there's a plateau, and then it's followed by an orgasm. If you're a woman, you might have more than one orgasm. And then there's resolution or a refractory period. But this is very linear. It happens, desire, arousal, plateau, orgasm, resolution, never really changing. And it's a very consistent model. In the early 2000s, Rosemary Basson is a researcher from University of British Columbia, and she had worked with many, many, many women. And what she said is that, you know what, it's actually more like a circle rather than a linear approach. And she said, in the setting, so in her model, in the setting of emotional intimacy. Now, that's not to say that a woman can't have just one-off casual sex. She certainly can, but she still needs to feel safe and secure in that environment. And in that safe and secure environment, it will motivate her to move from a sexually neutral position to be responsive to sexual stimuli and potentially become subjectively aroused. And so if she is responsive to this sexual stimuli and she becomes aroused, she may begin to feel desire. And if she has an emotionally and physically satisfying experience with or without orgasm, she does not necessarily have to have an orgasm. But if it's a satisfying experience, it brings her back around the circle to being receptive again. And in this model, the goal is not free floating desire. Most women are not walking around thinking about sex, looking for sex, wishing that they could have sex. The goal is to be sexually neutral and not be pushing it away, not necessarily be looking for it either. And then to be responsive in the setting of some kind of stimuli. And this whole sexual stimuli box is a very interesting box. And we'll talk about it a little bit more. But everybody's sexual stimuli preferences are different. They're very individual. And this can be any number of things. And it's governed by our psychology, our biology, our history, our cultural background, all of those things. When you look at this, and I talk about this with women, this makes a ton of sense to them. And they're like, yeah, I'm not walking around feeling free floating desire, but yeah, I can respond. And so that makes a lot of sense. A woman can enter this cycle from any point in it. But again, the point is to be receptive, not pushing it away. Another model that I think is really helpful when we think about human sexual behavior is that all human sexual behavior, men, women, the whole gender spectrum, everybody, is a balance of accelerators and brakes. And there are things that make us hit the accelerator, and there are things that make us hit the brake. And especially as women, we so often feel like we need more accelerator. We need fancy lingerie, and we need flavored lube, and we need porn, and we need a date night, and we need all these things. When in reality, so often what it is that we need to get our foot off the brake. And there are so many things that make us hit the brake. So many things. It could be that you worked 70 hours that week. Could be that you have the flu and you're just kind of not feeling all that great. Or maybe your mom's visiting, or you're worried about your kids, or you have a big project at work, or maybe your partner just came in from a big long jog or something and they're all sweaty and you like them to be clean. So it can be anything from something very, very big and substantial, like a major medical diagnosis or something like that, to down to just something sort of simple, like, well, you're kind of sweaty, I'm not too into it. But the point is that, those different, that it's the sexual tipping point. It's that balance of accelerators and brakes. And one of the biggest brakes in modern society is stress. We are constantly living in stress. And I would argue that when you are faced with the saber-toothed tiger, Mother Nature does not want you to stop and have sex. That's not going to be helpful to you in that environment. And so stress is a very significant factor in terms of our sex drive. And so this is all very helpful as women for us to understand. Maybe we're not feeling like the sexiest thing on the planet because we've got a lot of things going on that are making us hit the brake. So there are some very simple steps that anybody can take to improve libido. One is kind of counterintuitive, but it is scheduled sex. And what happens when you sit down with your partner and you say, all right, let's figure this out. Let's look at the calendar. I have a light day on Thursday. Why don't I come home a little bit early? Why don't you come home early? We'll have a bedroom date. What that does is a couple things. One is it takes away the anxiety on the non-sex days, so the temperature goes down, everybody's a little calmer, and it takes away the avoidant behavior. Remember, you don't want to be avoidant. And that sort of feeling of like, oh, I'm going to lay in bed and pretend to be asleep and hope that arm doesn't come across, whatever, that's avoidant behavior. And you don't want to get into that. So scheduled sex is a nice way to kind of deal with that. The other thing it does is it raises your endogenous testosterone levels. So it makes your own testosterone levels go up, which makes you be more interested and want to have more sex. You don't get good at playing tennis if you only play every 6 months, right? So scheduled sex can really kind of break that pattern of avoidance and raise your testosterone levels. So it's a simple technique that sex therapists use, and it's very effective. The other technique that I just want to offer to you is the idea of creating your own erotica menu. Because, especially again, as women, we often lose sight of our own sex drive because we're always feeling like a crummy partner and we're feeling bad. Oh, I love my partner so much. I wish I wanted it, but I just don't. And then that just gets into guilt, shame, and sadness, which are not sexy emotions. So what creating an erotica menu does is helps you get back in touch with your own sex drive. And it's in there somewhere. It was there before, it's in there somewhere. And everybody likes different things. You know, some people like toes, some people like a back rub, some people like porn, some people like a song that is a romantic song that reminds them of a lovely time that they shared with their partner. So there's lots of different things, but one of the things that can be very helpful is just spend a little time thinking about what you like rather than feeling guilty about not being a good partner. Okay, so we've done two things. We've done sleep and sex. The third thing is about healthy nutrition. So maybe your thing was about, you're trying to pay attention to your diet, you're trying to eat more healthy. So what does that look like? Well, Michael Pollan has helped us think about how we should eat. And what he wrote several books on this, and his kind of overarching philosophy is eat food, not too much, mostly plants. Pretty straightforward. Eat food, not too much, mostly plants. So what does that exactly look like? Well, this is one of those times when I'm going to talk about setting up our environment for success, because 8 o'clock at night, when this guy's watching National Geographic, but when you're watching White Lotus or Only Murders in the Building or something, that is not the time to try to make good choices if you haven't already made good choices, because it's easy to send out for pizza or pop the popcorn or open up the bags of processed high sodium snacks. The time you wanted to set your environment up for success is when you were deciding what you're going to put in your refrigerator and what you're going to put in your pantry. So this is not the time because nobody has willpower at 8 o'clock at night in front of a TV. What you want to do is on Sunday, you want to make a big pot of minestrone soup or paella with quinoa, or get your beautiful vegetables all chopped up and put in Ziploc bags so you don't have to work on it the night that you're tired and you're just wanting to snack. So set up your environment for success so that it's easier for you to make those healthy choices. And then what does that diet actually look like? Well, it's a wide variety of foods. We always say eat the rainbow, so lots of different colors. Always keep an eye on portion size because, I don't know if anybody ever got fat eating strawberries or tomatoes, but still, I mean, if you're eating whole grains and beans, peas, and legumes, if you eat a lot of it, you can gain weight. But when you think about your plate, half of it should be fruits and vegetables. A quarter of it should be whole grains, not white enriched pasta, but brown rice and quinoa and farro and things like that. And then a quarter of your plate is beans, peas, and legumes. And that's where you're going to get your protein. Now, if you ate like that 100% of the time, you would be vegan. And most people can't be vegan, and they don't really want to be vegan. But if you ate like that 2 days a week or 3 days a week, that would be great. That would make a big difference in terms of your overall health. So this is where I'm talking about good enough, right? You don't have to be 100% vegan. And if you need a burger, go have your burger and enjoy it. That's fine. But, if you do that 5 or 6 times a week, then you're going to see the effects of that. So you want to cut down on animal products as much as you can. Fish is fantastic. It's got lots of, omega-3 fatty acids, which are really good for heart health. It's really probably of all the animal proteins, it's probably the one that we recommend the most, especially if it's oily like mackerel or salmon. You want to limit added sugar and shun trans fat. And those are things that are going to come along with your whatever you're putting in your mouth if you're opening up bags or boxes or cartons. So you really want to eat a whole food, plant-based diet. What does whole food mean? Well, an ear of corn is a whole food. Frozen corn kernels are minimally processed, so that's fine. Corn chips are what we call edible food-like substances, and they are not real food. So that's where your added sugars, your added trans fats, your sodium is going to come. So you want to be really careful about eating a lot of processed things. That's not going to do you any good. You want to pay attention to vitamin D and calcium and protein, especially women, because as we age, we start to worry about osteoporosis and a thing called sarcopenia, which is where your muscles begin to waste and they get marbled with fat and they get smaller and shrink, which increases your risk for falls and messes up your balance and all of that. So, and frailty fractures and just being frail in our golden years really happens because of the choices we've made over the decades before. So you need about 2,000 international units of vitamin D. I do recommend that in a supplement. Calcium, 1,200 milligrams a day, only about 500 to 600 in a supplement. Any more than that's going to deposit in your coronary arteries, in your heart. So you want to get that through your diet, and you can get certainly plenty of calcium through plant-based sources. And then you want about 1 gram of protein per kilogram of body weight. So if you weigh 130 pounds, that's about 60 kilograms. So you want about 60 grams of protein a day. And as you get older, if you can get closer to 2 grams of protein per kilogram of body weight, so much the better. Because again, we tend not to take in so much protein as we age, and it's really important for muscle mass. Again, real food, whole food, over supplements. People always ask me, what supplements do you recommend? I really don't. I just recommend vitamin D and calcium. Vitamin D, especially because when we're 20, we go outside for an hour and we make like 100,000 units of vitamin D in about an hour. Whereas being 60 or 65, you go outside, you can spend all day out there and you won't make that amount of vitamin D. So you do need to take that in a supplement. Be careful about drinking your calories. Soda is one of the worst things for just mainlining sugar. You want to limit your alcohol. Any more than 7 drinks per week for a woman increases her risk of breast cancer. So you want to be careful about that. But then again, we have to live in this real world. And if it's Thanksgiving, enjoy your feast and just enjoy it. And when you decide you're going to have pasta or a baked potato or a burger, whatever, absolutely enjoy it. And then good enough. So try to get back to the plant-based diet the next day or, as much as you can. I always want to remind people that the Mediterranean diet is a nice kind of way to incorporate this into your routine. And it's, it doesn't limit animal products completely, but it's very much a plant-based, healthy oils and fish and that sort of thing. So it's a great way to structure your diet. Okay, so maybe your thing was about exercise when you thought about what you're doing to support your health. But I challenge you to stop thinking about it in terms of exercise and start thinking about moving your body, because moving your body is the point. And again, good enough, whatever you can do is good enough. The benefits of exercise, of moving your body, are profound. People who move their body have better sleep, they have better mood. It's a mood elevator. They have better sex. They have better concentration and focus. It lifts the brain fog. and their pro-inflammatory markers decline. So it decreases inflammation in the body. So all of those good things. It also decreases the risk of chronic illness and falls, again, which is super, super important as people are aging. But this is an area where I find my patients really beat themselves up on this, and they're just really feeling like they're not getting out as much as they want to, and they're busy and all that. And this is where you just do the best you can. And, if you've had a long day at work and you're going home an hour after you thought you were going to, and all you do is drive by the gym and you say, I see you, Jim. I'll be there tomorrow. That's good enough. That's good enough. And if all you do is go to yoga class and you do child's pose for an hour while you sob into your yoga mat, I mean, that's good enough. You got there. So just don't let perfect be the enemy of good. Just do what you can do. There's no amount of exercise that's too little to give you benefits. So if you just walk up a flight of stairs instead of taking the elevator, you get benefits from that. If you just get up from your desk and walk up and down the sidewalk outside, you get benefits from that. So good enough. If you want an exercise prescription or a movement prescription, I will give that to you. And this is the amount that's been shown to be beneficial. 150 minutes of aerobic exercise per week. And you can do it all on the weekend, or you can do it divided up daily, 20, 25 minutes a day, whatever works for you, plus 2 episodes of strength training. And that can be Pilates, it can be yoga, it can be handheld weights. But you want that strength training to really stress your bones and muscles to prevent falls and weakness and frailty as you get older. I wanted to just take a moment and shout out yoga and just say yoga has such benefits. It's low impact, which is good. It also incorporates breathing practices, which we know are very beneficial because they're so calming to our system. And so the breathing, the low impact, it's especially nice before bed as part of a routine to help you calm down and move towards sleep. It's not a good idea to do vigorous body movements more than closer than 2 hours to the time you go to bed, because it will tend to sort of amp up your system. Except yoga is a lovely way to kind of move toward bedtime. So I really want to encourage people to experiment with that if you haven't. Maybe your thing was about working on your mood and trying to do things to elevate your mood. Well, what does science tell us about ways we can set up our environment to promote our mental health? There are some things we can be very intentional about. One is spending time in nature. The Japanese call this forest bathing. And it really has been shown to be in nature really quiets the brain, and you get less activity in the anxiety, ruminating, depressed portions. So being in nature is very beneficial for our mental health. And the benefit of sunlight on mood is real. And seasonal affective disorder is a real thing. And when we get into the sunny part of the year, people's moods tend to improve. I also wanted to just take a moment and say a word about the beneficial effects of having pets. And in fact, dogs in particular, I mean, no shade to cat lovers, cats are wonderful too, but dogs in particular really do boost people's mental health. And so having a pet is a way to help promote your mental health. And then the value of breathing practices are also very real. And it's one of the things people learn to do when they're doing cognitive behavior therapy and mindfulness for insomnia. If you are lying in bed and you're trying to fall asleep, taking 10 very slow, deep breaths in and out and counting them is a nice way to turn off the monkey mind and just start focusing on something other than your ruminating thoughts. And when you do that, and I would encourage anyone who's hearing my voice right now to take a few slow, deep breaths and just breathe in and breathe out. What that does, if you do that in a consistent, mindful way, it reduces anxiety, it reduces symptoms of PTSD, of insomnia, depression, ADHD. So just simple, paced, slow respiration is very beneficial. So you might just put a Post-it note to self on your desk, just breathe, remember to breathe. I wanted to take a moment and specifically address the issue of mood in midlife and menopause and how those two things interact. So menopause is no period for 12 months. So and for most people, that's around age 50, 51, 52, somewhere in there. You only know that in the rearview mirror because you don't know when you're having that last period until it's been 12 months. Subsequent to that. So then you go, oh yeah, that was my last period. But it doesn't happen like flipping a light switch. It's not like your periods happen every month and then boom, you stop. There is this transition time, and the transition time is called the perimenopause, and it's when people start skipping periods. So you go maybe 2 or 3 months without periods, and then maybe they start up again, and it just stops and starts. That's usually in the 40s. Average length of perimenopause is 4 years where that's happening. It can range from 1 to 10 years, which sounds miserable to me because it's the most symptomatic time when people are having a lot of symptoms. Early menopause is when people have gone through menopause between the ages of 40 and 45. And then premature, what we call premature menopause, is menopause before age 40. And how does this intersect with mood? Well, this is crazy, because we all know what PMS is. Premenstrual syndrome, which is when people are having periods and their mood fluctuates with their period. Well, PMI, perimenopausal mood instability, is more common than PMS, but we never talk about it. People have never heard of it. Almost 70% of women get perimenopausal mood instability. It's a real thing. And even if they've never had any history of depression, or anxiety or any kind of mood disorder, they still have that 70% risk of having it. And if they have a history of like postpartum depression or depression in college or PMS, it's almost 100%. And people think they're losing their mind because it's irregular, the symptoms are unpredictable, and it's hormonal. It's very important in this situation to go see a provider, make sure that it isn't major depressive disorder or major depression, because that can sometimes be the case. But if it is perimenopausal mood instability, stopping the hormone ups and downs and stabilizing those hormones is a very effective way to treat that. And so I really urge anyone who's listening to this who is in that 40s timeframe and they're feeling really off balance with their moods to see a provider about that, because that can be treated. In terms of managing menopausal symptoms, 80% of us get hot flushes. That's the most common symptom. And those typically kick in long before your period has stopped. So when you're skipping periods, that's when people are starting to notice hot flushes. And on average, if you did nothing and you said, nobody ever died from hot flushes, I'm just going to wait this out, the average duration is around 5 to 7 years of this. So that's a long time to wait. Menopausal hormone therapy, MHT, what we used to call HRT, menopausal hormone therapy will take them away in about 4 weeks, which is wonderful. People are so relieved. Plus, if you take menopausal hormone therapy, it will provide mood stabilization. That PMI gets better. It helps people sleep. The vagina loves estrogen. And so taking hormone therapy improves the vagina, often cures that pain with penetration. It also promotes bone health and heart health if you take it under age 60 or less than 10 years out from menopause. So if you're younger, under age 60, or your menopause happened within 10 years, you're going to get bone health, heart health, and decreased all-cause mortality, meaning you will die. People who are on hormones die less frequently from all causes. So it's very beneficial. The only people who shouldn't take hormones are people who have breast cancer themselves, not a family history, but themselves with breast cancer. People who have had a heart attack or a stroke themselves, or if they've had a blood clot in their leg or their lung or their brain. So those are the general broad categories of people who should not take hormones. Everyone else, usually you can be a candidate for it, and we can talk about that. And it's very beneficial for treating those symptoms when everything's really becoming unpredictable and changing a lot in the mid to late 40s. Okay, the last thing, maybe your thing was about friendship, connection, staying connected to the important people in your life. This is the most important thing. This is really such, I think, important data and science to be aware of, because in all the studies looking at what promotes long life, it isn't cholesterol, it isn't your blood pressure, it isn't whether or not you have diabetes, it is how connected are you to people in your life. And we used to think it was marriage, that marriage was protective. It's not, it's being connected. And if you have a friend that you could call in the middle of the night, if you got bad news, or if you needed something and you were scared, whatever, if you have someone in your life like that, you are more likely to live longer than if you didn't. It is so important to nurture our connections, because our happiness really depends on it. And in fact, it's important to choose the people in your life very carefully, because friends influence each other both positively and negatively. And so we know this, in couple friendships where couples are hanging out together. If one couple gets divorced, the others are more at risk for divorce, separation, and divorce. If you are pursuing healthy habits in your life, you want to choose friends who are also pursuing healthy habits. And you're only as happy as your most unhappy friend. So your happiness depends on the people you surround yourself with. Each additional happy friend increases your happiness by about 9%, which is amazing. So this is really, really important. Call your friends. And geography really matters. It's important to be close to the people that you love, so that you can have those connections in your life. And finally, I want to leave you with this thought that we all have a purpose in our life. And if you know what the meaning of your life is, if you know what the purpose of your life is, you will be happier, because you will always know if you're in the right place doing the right thing for you. And it's just for you. Nobody can tell you what this is, but taking a moment and thinking about something that I know about my purpose is a very, very worthwhile exercise. It's very worthwhile. So I offer that to you as something that would be worth spending a little time trying to get that clarity for yourself. All right, so to just summarize and recap the strategies, the things that you should prioritize in your life to improve your overall well-being are good sleep, good sex, healthy nutrition, moving your body, stabilizing your mood through things like being in nature, pets, and breathing practices. Manage your menopause symptoms. Oh my goodness, I cannot emphasize this enough. It just makes me so sad when I hear somebody just suffered through their menopausal transition because they didn't have access to treatments. And so know that those things are treatable and get those managed. And then finally, treasure your connections, treasure your friends, treasure your families, find your sense of purpose, figure out why you were put on this earth, and really center that in your life. Finally, remember, set up your environment for success so it's easier for you to make the kind of choices you want to make. And then always, always good enough is perfect. And it's a journey, and you don't have to do it all today or be perfect today. Just do the best you can, and that's going to be absolutely the right thing to do. So now I will stop with that and take your questions. Here is our contact information in the Menopause and Healthy Aging program. And we would love to hear from you if you're interested in partnering with us, or if you have follow-up questions, you can certainly be in touch. And that's it. And so I think I will stop sharing.
Well, thank you so much, Dr. Adams. We've gotten a lot of questions. We've gotten more than several about the hormone replacement therapy, or now it's menopause, right? And replacement therapy. Both, with your view on taking them perimenopausally, and also after 60. If you are in perimenopause but don't really have symptoms, all of those kinds of things.
Right. So I am so glad that someone asked about perimenopause, because perimenopause, it can start, in your early 40s. And I have patients who just stopped breastfeeding their last baby, and they are going into perimenopause, and they are having hot flushes. And so just because you're still having periods now and then does not mean that those are not hormonally driven hot flushes. So that's important. Hot flushes can be due to other things as well. They can be due to abnormal thyroid. Sometimes anemia, low iron can cause them. Other medical conditions like malaria or pheochromocytoma or some cancers. And so, it's always important to see someone and get it all sorted out. But if it's related to hormones, taking hormones will fix that. Now, in the perimenopause, as long as you're still having periods, you can get pregnant. So you have to be very careful, because hormone therapy, menopausal hormone therapy, is not enough hormone to suppress your periods, suppress your ovulation, and provide contraception. It will not do that. So you have to think about, what are you going to do to treat your symptoms in the perimenopause? And it's a little bit different from what we would offer after 51, which is true, what we used to call HRT, we now call it hormone therapy. It is about a quarter of the strength of the lowest birth control pill. So a birth control pill is 4 times the amount of hormone that's in MHT. So it's quite a bit more hormone. That's why it provides contraception. So for some people, a birth control pill is a good answer in perimenopause. For some people, a Mirena IUD, a levonorgestrel containing IUD that suppresses periods, is a good idea, because it will give you contraception and it will manage the abnormal bleeding. And then along with that, we can add a little bit of estrogen to treat the symptoms. So perimenopause is a little bit of a different situation than postmenopause. So hormones are managed a little bit differently to manage those symptoms. The other thing that's an important point about perimenopause is your hormones are completely unpredictable, irregularly irregular. And so people sometimes come in and they ask for hormone levels. They want their blood drawn to see where they are. And I always explain to people, I could draw your blood levels every week for 6 weeks. And sometimes they would be up and sometimes they would be down. So hormone levels really don't diagnose perimenopause. It's really about what your symptoms are and what is happening with your periods. So those are important messages, I think. And then once you're through menopause and you have had no period for a year, then we do menopausal hormone therapy, or MHT, which is a very small amount compared to birth control pills. And then that you start on under age 60 or less than 10 years out, and you can stay on that.
All right, continuing a little bit on the hormone therapy. Can you be on hormone therapy with a history of breast cancer? But not active breast cancer.
Right. Yeah, most of us feel like that's probably not a good idea to be on hormones when you have had personally a history of breast cancer. If your mother had it or other people in your family, but you haven't, That's a different situation, and we sort of figure out a risk-benefit balance. Most of the time, we think being on hormones does not increase your risk above and beyond your background risk. So, if you have a BRCA gene or something like that, you still can consider being on hormones. However, if you yourself have a diagnosis of breast cancer, we recommend not. And there are good alternatives. There's a new drug that came out in the past year that is a non-hormonal treatment for hot flushes. So now we have something that really has been a game changer for our patients with breast cancer for treating hot flushes. It's called fezolinetant. Fez, you just call it Fez. And it's just a once-a-day pill, and it works very well to manage hot flushes. Now, people who have breast cancer can use vaginal estrogen. And so there is a type of estrogen that is not a pill that you swallow or a skin patch that you put on your skin. It's just cream that you put in the vagina and or on the vagina, just like a little bit on your fingertip to help with painful sex. And you don't absorb that type of estrogen into your bloodstream. So even if you have breast cancer, you can use that. And that can make a big difference for treating pain with penetration. But in general, even if your tumor type is estrogen and progesterone receptor positive or negative, we don't usually recommend hormone therapy for people with breast cancer.
Okay. Thank you. On a different topic now, how can we best manage osteoporosis without medication?
Well, it's all about lifestyle, all about, and, there are certain things that increase people's risk for osteoporosis. The one good thing I know about being obese is your bones get strong because you carry the weight around on your bones. And so it's rare to have osteoporosis if you're obese. The people I worry about with osteoporosis are those very frail, very small framed women who don't have a lot of stress on their bones. I worry about that. If you have a family history, if your mom had a hip fracture, that increases your risk. If you drink alcohol, that increases your risk, more than 7 drinks per week. If you smoke, that increases your risk. If you are on certain drugs, if you're on drugs for rheumatoid arthritis, steroids, things like that will increase your risk. So, and then Caucasian is a risk factor. Asians also have higher rates of osteoporosis. Black women, Hispanic tend to have lower rates. So, all those things are risk factors. You want to be careful about things like smoking, and you want to do weight-bearing exercise. We reach our peak of bone mass in our late 30s to early 40s. And then the whole rest of our lives, we're just trying to hang on to what we've built. So strength training, weight-bearing exercise, calcium, vitamin D, all of those things are very, very important. And then, the guidelines say to get a bone density scan at age 65, but if I were queen of the world, I would change those guidelines to say when you go through menopause, because that's the time when bone loss accelerates, and that's when treating is so, so, so beneficial. A hip fracture in an elderly person is a disaster. It's a disaster. 1 in 4 women who fall and break a hip will die, and another 1 in 4 will be permanently disabled from that hip fracture. So once it happens, the jig is up. You have to prevent it. And so preventing it is about strength training, weight-bearing exercise, calcium, vitamin D. And if you have osteoporosis, treat it. Treat it with medication because it is beneficial and it will work to prevent fractures. And there's a type of fracture that people get when they're on osteoporosis treatment. It's atypical femur fractures, but those are very, 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 very rare, very rare. And the risk benefit tips way toward benefit if you have osteoporosis for treating it.
Thank you. What are your thoughts on why belly fat and 10 extra pounds seems to happen after the age of 55?
Yeah.
No matter what I do, the writer asks, it won't go away.
Truth. That is truth. Yes, spot reduction never works unless you're having surgery to remove it, but you can do all the crunches in the world, but it really is about your overall weight and the body fat distribution. And it's true, if you eat exactly the same and exercise exactly the same, when you go through menopause, you will gain weight and it will sit right around your middle. And that's because of the metabolic changes that happen in menopause and the shift in our lean body mass. Hormone therapy does change that, and it results in small but significant changes in our lean body mass and our body fat distribution. So hormone therapy helps with it a little bit, but it really is essential in menopause to exercise and be careful about what you're eating. Moving our body is good for so many different reasons, but weight management is about what we're eating. And you cannot spend enough time on the treadmill to work off the calories in a bowl of pasta. You just can't. And so, that's fine. You can have pasta, but if you have it 5 or 6 times a week, you're going to see it on the scale. So you have to be very mindful of that. But yes, you're not losing your mind. It is real and it happens. And it's just part of the process of moving into our 50s.
Okay, and I think we've answered most of these questions. Hold on, let me just go.
And let me just finish with menopausal zest is real. Menopausal zest is a good thing. And when they do big studies of women, once they're through perimenopause and menopause, they are happier all the way around. They're happier with their relationships. They're happier with work. They're happier with themselves. And so don't let this sound like it's the worst thing in the world. Once people reach their 50s and they're through menopause, happiness just increases and increases and increases. So you should look forward to it. It's a time to really get in touch with your purpose and to get in touch with what matters to you in life. And most people do come through it very well. And on the other side, they're happier. So I want to leave you with that message of hope that come on in, it's fine in your 60s and beyond.
Well, thank you, Doctor, for sharing all of this great information. And also, I want to thank our audience for joining us and for the good questions. If you'd like additional information or resources, please contact the Stanford Health Library. And we hope you can join us for our next lecture. Thank you.
Thanks, Jean, so much. Good night,
Thank
everyone.
you.
Mhm.